Hey, it's Dr. Marisi with Minutes for Moms here to give you more practical pediatric advice. This video is going to help give you guidance about acne, how to treat pimples in your teenagers and adults for that matter. From an acne standpoint, that is a very common thing that we have to work with our teenagers. In this day and age, we now have so many things that are over the counter that it makes so much easier for you to just take care of it without actually seeing a physician or actually having to spend money on an expensive prescription. So this guide's going to be working with more the over-the-counter things, and if the over-the-counter things don't work, that's when you go to your physician and they will give you different prescriptions to kind of help minimize your pimples. So one thing that I will start with when I'm talking with my teenagers is I ask them, what do you think about your face? Does the acne on your face, does it bother you? And if they say it doesn't bother me, then I tell them, when and if it does, then you let me know, then we'll go over some different things. Because if you spend a whole bunch of money on all this acne care, and if it doesn't bug that teenager at all, they won't use it. What will happen is you will nag them, and they will say that they're using it, but they're not using it. So the most important thing when it comes to starting to work with your teenager about pimples is if it bugs them, then we're going to work with it. If it doesn't, then you just let them know, hey, if it starts to bug you, if you get self-conscious with it, you let us know. So the first thing that you start with when you're looking at how to treat for the over-the-counter stuff with acne is you want to use a very good facial wash. You want to use something that has salicylic acid in it, something that kind of will help the acne formation. And I'll usually tell people just put it in the shower, and I want them to wash their face at least twice a day, morning and night. So if we always take a shower in the morning, have that in your shower. They'll wash their face in the morning, and if they don't take a shower at night, then you're going to also have that same facial wash next to the sink, because if they're brushing their teeth, they're washing their face, you can kind of get that all done together. So basically that's the first thing that we start with, is making sure that we're getting a good facial wash. The next thing that happens is if that acne is starting to become more prominent and we're getting more self-conscious, you want to use benzoyl peroxide. What that happens from a benzoyl peroxide is that kind of helps minimize that acne formation. They have different formulations of benzoyl peroxide. They have a 2.5%, a 5%, or a 10%. The recommendation is go between the 2.5 or the 5%. The higher the number, if you go up to 10, all that does is dry your skin out more, but it doesn't give you any more added benefits. So I tell people you want to stick to the 2.5 or the 5% benzoyl peroxide. The thing you want to remember from the benzoyl peroxide is it is actually very drying. It is very irritating. So you're going to, if you're going to use it as more of a wash because it's so dry, you can put it on and then rinse it off. And then after your skin gets used to it, you're gonna treat. You're not going to put a whole bunch on and go like this. You're going to spot treat and then rub in that whole area. Spot and then rub in that whole area. And that's kind of how you're going to do that. Now you want to remember benzoyl peroxide has a bleaching element. So I don't want you to spot treat and then put your favorite pajama top on, or your favorite whatever, or you touch your towel, or you go lay down on your favorite pillowcase, or you get it on your comforter, because it will completely bleach your clothing or whatever material it is. It will definitely bleach that out. So you want to wait, get that kind of dry, and then you can put things on. Or I just tell people, just make sure that you're using old stuff. So you're going to start with that benzoyl peroxide. Do that at night. It's easiest. And then you go to bed. And then in the morning, you're going to wash it off, and things are going to be completely fine. Now, if that benzoyl peroxide helps, but we still need to do more, another thing that is over the counter is Differin gel. And what Differin is, it's a retinoid. And what that does is that helps target your acne different than your benzoyl peroxide. So we're doing two different things to help minimize that acne. So then what I'll have you do is you're going to do the benzoyl peroxide at night, and you're going to do the Differin in the morning. So then you are benzoyl peroxide, Differin, you do that exact same thing. You're going to point it and then you're going to rub it in. You're not going to put a whole bunch on and then do that like we do sunscreen. And that will definitely make a big, huge difference. The other thing that you want to remember when you're using any of your acne care, be it prescription, be it over the counter, is it definitely is going to dry your skin out. So when you are looking for a moisturizer, what is most important is you're going to buy something that says non-comedogenic. So non-comedogenic means not acne forming. So if your lotion does not say that on that, that's going to increase your risk for having pimples form because of how it locks that sebum in and just makes things worse. So that non-comedogenic is the most important thing that you want to see written on your label of your moisturizer. And that should definitely help. Now say you're doing that, things are better, but as things progress, all those over-the-counter things aren't working, then that's when you go see your physician. That's when they will do different prescription and will definitely get your skin under control. So, to recap everything, remember, you ask your teenager, does your skin bug you? If it does, then we're going to do something with it. Then it's worth that investment. You're going to get a facial wash that has salicylic acid in it. You're going to start with benzoyl peroxide between 2.5 and 5%. And then if you need to, you're going to do Differin, which is a retinoid, and that will help as well. So, hopefully that gave you nice practical pediatric advice to help give you guidance for your teenager with acne. Once again, I'm Dr. Morazy with Minutes for Moms, here to give you more practical pediatric advice. Give me a like, subscribe to my channel. If there's any information you would like for me to cover, please give me that in my comment section. Once again, now you know what I know. Until next time, thanks.